Hi, I'm Aaron Carroll.
I'm John Green.
And this is Healthcare Triage.
And today we're going to answer some of your questions. All right, Aaron, this question comes from Roseperson. What policy change could have the biggest benefit for U.S. health?
Well, we're starting off easy, aren't we? I guess if I had to pick one thing to do, it would be as if we could somehow transition the way that we reimburse care from sort of doing anything and how much volume it is to sort of trying to pay for things perhaps that work versus not work. I think the likelihood of that happening anytime soon is pretty small, but that would do a lot.
What kind of daily exercise is best long-term? Walking, running, short versus long distance, cycling, etc.?
You know, people ask that kind of question all the time, and the simple answer is whatever you will do for a long period of time, meaning that whatever you will do consistently. The same thing has been shown with diet. You know, people will wonder what's the best kind of diet. The truth of the matter is whatever will work for you and whatever will stick so that you keep doing it over a period of time.
And how much exercise should I be getting a day?
I think most people would say 30 minutes of activity a day. 30 seconds is too short,
He said 30 seconds?
Nope, too short. 30 minutes.
Go. I'm almost there.
Heart elevated, 30 minutes.
All right, 30 minutes a day. What if I want to do like 2 hours a day? Is that a problem?
No, as long as you can handle it, but the problem that most people do is they push too hard and then they get sore or they get tired or they can't sustain it over a period of time and then they stop, and stopping is what we want to avoid.
Like that day that I ran 8 miles and the next day I couldn't walk.
Exactly. Well, I tried P90X for a while and it's like it took me half an hour to get out of my car.
Ben asks, hey, you're a doctor, can you take a look at my rash?
Sure. Yeah, it looks fine.
Yeah, I think you're all right. Yeah, I'm not a doctor, but that
looks
no big
fine.
deal. njnerdymom asks, why are some hospitals more prestigious, like the Mayo Clinic, and are they better?
Well, some are prestigious because they have very good PR departments and very good advertising. Some are prestigious because they make a lot of money, and some are prestigious just because they have high quality people that work there. It's not like every hospital is prestigious in everything, so some may be good in some things and not as good as other things. Some may be good at everything, but there's no great evidence that necessarily the prestige translates into quality or better care.
onceuponA asks, will you please use Healthcare Triage to tell my dad that soda isn't leaching calcium from my bones?
Yeah, this is a myth. It's actually related to the fact that in early evidence they showed that carbonated beverages slightly increased how much calcium will be in your urine. But what they didn't tell you on the backside is that your body quickly readjusts to retain more calcium so that you don't lose any over the aggregate. And studies that have been done over long periods of time with different kinds of carbonated beverages have shown that people don't have problems with relationship to their bones or breaking them. I happen to know onceuponA, and I know that this is a question from her dad, so I'm telling Adriana's dad, don't worry about this.
Emily asks, what are the actual risks and benefits of home birth versus birth center versus hospital?
That's a great question, and unfortunately it's not terribly easy. I mean, of course, you go to the hospital for sort of insurance purposes, not insurance of health insurance, but just in case something goes wrong, you're there. But the truth of the matter is that the vast majority of births are going to do just fine and probably would be great at home and don't really need that, but I think most people go to the hospital for the what if.
This is helpful to me because, as you know, I am a massive hypochondriac, so I would be asking all of that.
Well, that's good.
What you don't know is that I ask Aaron all of these questions when the camera isn't on.
But I give you the same answers, I think.
I know you do. Consistently the same
very
answers.
consistent.
Yeah. psionedge asks, does privatizing Medicare/Medicaid have any evidence of saving money while actually working?
Yes, in the sense that when they look at sort of Medicare Advantage programs, which are private companies which are administering Medicare across the country, if you look at it in a county-to-county basis, there are places in the country where Medicare Advantage is actually providing the Medicare benefits for less money. Those are much rarer, however, than the times when Medicare Advantage is costing much more money. So if you're asking me, is there any evidence that in some markets private insurance can provide Medicare benefits more cheaply than Medicare can? Yes, but holistically overall, the government is probably more efficient at providing those benefits.
Does improving patient satisfaction scores affect other outcomes?
Oh, wow. See, questions like this sound simple, but are just not, because the question is, what is satisfaction and what are the outcomes? And there are studies that show that patients who are more satisfied and have a better relationship with their doctor actually might adhere to recommended therapy more closely and therefore get a better benefit.
Definitely true for me.
But there are also studies that show that trying to please patients in an effort just to get better satisfaction often can lead to increased costs and less less good outcomes. And that was actually shown in a study published a couple years ago that got a lot of press because they were showing that satisfaction actually cost more and even led to higher mortality. But that's because sometimes doctors go overboard in an effort to please patients do the wrong thing. That's not good. But building a good relationship in order to improve satisfaction, that's a good thing.
So this is one of those places where actually sometimes satisfied customers are not the healthiest possible customers.
Correct, and we often what people want is not what is best for them, and sometimes you have to explain and do things that might make them more upset in the short term, but you try to do it in a manner that builds a bond that hopefully increases the quality of the relationship in the long term.
I've been asking my doctor, who you recommended to me, to give me Botox for months because I'm becoming an older gentleman and I'm on YouTube and there's no room on YouTube for wrinkles.
Right.
He just is completely unsympathetic to my position.
As would I be.
And so I give him very low patient satisfaction scores.
That may be, but see, I think he's probably doing you a service in the long run.
Okay, this question is from James. What's the #1 thing you can do to help you live longer?
I would need to know James to answer that question. That's
I
the
can
problem.
show you a picture of him. He looks like that.
It depends. You know, if you smoke, the #1 thing you could do is stop smoking. If you are eating unhealthily, the #1 thing you could do is eat better. If you don't exercise, the #1 thing you could probably do is exercise.
Let me ask you this. This is a totally personal hypochondriac question. If I'm choosing between changing my diet so that it's heavy in fruits and vegetables, lower in fat, or exercising, which of those is more important to me living a longer, healthier life?
Looking at you and knowing you, I would say probably exercising, because I would imagine just you're not obese, your diet is probably decent to begin with, and any changes.
It's not great.
Okay. Well, any changes you're probably making are at the edges. You're not talking about probably eating multiple servings of meat a day or eating so much that you're really unhealthy. So in that case, probably getting good exercise would be better off.
That's helpful. All right, I have a few more questions for you. How effective is stretching for preventing sports-related injury?
Not at all.
In fact, isn't it bad?
Not at all. This is one of those that blows people's minds, but there have been systematic reviews. There was one I think in 2004, and they looked at hundreds of trials. There were 6 good studies, and none of them showed that stretching prevented injury. There have been other studies to show that warming up and everything else, it doesn't actually make you perform better. And in fact, some studies show that when they randomize people to stretch or not, they don't run as fast, jump as high. In other words, they don't even perform as well. So you're not preventing injury, and you're potentially making yourself not play as well. So I don't know why we still do this.
Is it true that you should stretch after you exercise to minimize, soreness the next day or whatever?
I've seen no good evidence about the stretching. What I have seen people push is that you should just, walk perhaps, or just try to work your muscles through. And the idea is there you're trying to get the lactic acid out. I've not seen any good studies to say whether that's true or not, but that at least makes a little bit of sense.
Have there been studies that conclude that food dye does or does not negatively affect children's behavior?
I wish this one was as clean as sugar is, where it's so clear that there have been huge randomized controlled trials that show that it doesn't. But there are some randomized controlled trials of kids who already have hyperactive behavior, who have ADHD, pretty severe ADHD, where eating a lot of foods with some dyes could lead to slightly worse behavior in parents' eyes.
Wow.
So, having said that, if you have a child with severe ADHD and you're concerned about this and you want to try no dyes, okay. But the problem is that people extrapolate this to say, oh, if my normal child gets dye, that somehow he's going to be a bad kid. That there's no evidence for. And so the idea that we need to avoid these like the plague holistically, there's not much evidence for that.
There's no evidence for it, but it's possible.
Everything's possible.
Now
but
I'm freaking out about food dye.
No, and then you
too late. I'm on the crazy train. I've already left the station. I'm removing all dye from my child's life. He's already got a lot of energy.
Yeah, but see, the thing is, if you go to those lengths, you probably could make him hate you, and you're probably gonna, you want to have a better relationship with your child. That's more important.
He already hates me. We're covered on that front. Dietary cholesterol is not strongly linked to LDL blood levels. True, false, or in between? Also, what are LDL blood levels?
LDL is the low density lipoprotein. See, I knew that one.
Good or bad?
That is the...
Oh boy.
Oh my God, see, this is the danger.
HDL is bad, right?
HDL is bad, LDL is good. So this is a great question because it's...
Who's the doctor now?
Right. Well, this is where it gets... I rarely get asked this question with respect to LDL levels. It's always HDL levels, but they're sort of linked. The truth of the matter is that the vast majority of people actually are what we call hyporesponders, meaning that they don't actually respond with respect to their blood cholesterol levels to what they're eating in their diet. So that you could actually change what you eat tons of eggs, don't eggs. They did a study where they gave regular people 3 eggs a day, every day for a long time, no change in their dietary cholesterol. I mean, in their actual blood cholesterol. About 30% of people are what we call hyperresponders, meaning their levels do change with respect to food, but it's much less than you'd think. Changing your diet by something like 100 milligrams of cholesterol a day might bump it by 2, which is almost inconsequential.
2 points out of
2 points out of when we talk about like 200.
We're talking about hundreds, yeah.
Right. So you would actually have to change the amount of cholesterol you take massively to truly change how much cholesterol and get yourself from an unsafe to a safe level, which is why medications are recommended for people who truly are an unsafe level.
Is sitting as harmful as smoking? Please say no, please say no, please say no, please say no.
This is one of those, this was in the news a lot, and the study basically said that people who sit for 8 hours a day or more are more likely to have cardiovascular disease than people who sit for less than 8 hours a day. But what they really meant was that people who don't exercise are going to have a higher cardiovascular risk than people that do exercise. But there is no question that smoking is just bad. And if I had to say, which of these would I be more concerned about? If you're a smoker, stop smoking. I mean, that is by far the worst thing that you could do with respect to all of this stuff. Having said that, if you're not smoking, yeah, be less sedentary. It's only going to improve your life.
But in that study, didn't they say that like even people who exercise 30 minutes a day, if they have a very sedentary lifestyle, they're still at increased risk?
It is increased risk, but it's like increased risk. You know, how much more so? Smoking is going to be so much worse for you over the long term, and the risk that you could die than the sitting. Having said that, if you have a choice, do both. If you're not smoking, I would absolutely encourage you to be more active. But if somebody was presenting to me with both and said, I sit for 8 hours a day and I smoke, unequivocally I would say stop smoking. That would be number one.
Is sugar as addictive as cocaine?
No. But you know, the reason this was in the news so much, there was this crazy study, and I don't know if it was whether by high school students or college students, but what they did was they basically got all these rats to run through a maze, and for like some of the rats at the end of the maze, they gave them a cookie, an Oreo, and then other rats, when they got through the maze, they gave them cocaine. And so they found that the rats were just as eager to get through the maze, whether they got cocaine or a cookie. That does not mean that Oreos are as addictive as cocaine, and I don't know why anyone would think that that's the case. It means that rats like both.
Okay, discuss the evidence for nutritional supplements.
None. It's great for making really expensive urine. That's about it. They just don't work. I mean, the truth of the matter is that most Americans have a totally well-balanced diet, are getting the vitamins they need. If you have to, take a multivitamin. That's going to supplement you and probably put you over the edge. But the human body is just not meant to take in any excess vitamins or any kinds of supplements. Your body doesn't process them. It just pees them out. And so you're really not doing much at all. If there was some kind of nutritional benefit to eating more of this stuff, evolution would have pushed us and other animals to eat more of the stuff. We basically are conditioned to eat about the right amount of the stuff. Some people don't get enough. Multivitamin is fine. Some people get a bit too much. That's fine too. They're just going to pee it out. But the idea that we're going to massively supplement ourselves with any one vitamin or any one supplement, and that's going to drastically change our health, there's really almost no evidence for that at all.
Last question from me. You just said that nutritional supplements only make for expensive urine. Mm-hmm. I have, as you may notice, medium-sized guns. Uh-huh. I was thinking of developing gigantic guns.
Okay.
Wouldn't nutritional supplements potentially help me with my gigantic guns development project?
There's really not much evidence for that at all. Having said that,
devastating.
I know. Well, the thing was that this stuff was easy and it actually worked. It would work for regular people. It only seems to work for really extreme bodybuilders who were working so hard anyway that they were going to get massive muscle buildup. For the vast majority of people, it's just not going to make any difference at all. There is some evidence that recovery beverages like some of the protein shakes, or really there have been great studies that show that chocolate milk is just as good of a recovery beverage as the super expensive ones you buy in stores.
Oh, so now who likes milk?
Well, but darn it! They're always on to me. But that would be a small. Anyway,
Aaron Carroll. Pro-milk. You heard it here first.
Anyway, there's some evidence that actually recovery, but again, you're again talking about really intense, high-performance athletes, not us, or at least not me. Maybe
well,
you.
Probably also not me.
Okay, but so then none of the supplements are really going to make a difference at all.
All right. Well, thank you, Aaron, so much.
Thank
this
you.
has been tremendously educational, as it always is, and thanks for all your work on healthcare triage.
Oh, my pleasure. Thank you.
All right. Bye, everybody.